So what we are trying to do over here is very simple, that understanding a simple concept over here, how does the heart look like? When I say that word, how does the heart look like, you get a little bit of irritated because you know how the heart looks like. But I will show you how the heart looks like through an embryonic point of view. Okay? To start with, let me put it this way, we start with the two heart. So this itself gives you a little bit of, uneasy feeling that how come? We know one heart I'm taking. So I will be drawing now 201 times. Look at my drawing, the same drawing I'm doing it in terms of understanding the two heart, that how is it is possible. First of all, the same, when I draw like this, you know that this is the ectoderm, right? And this is the neural tube. I have to draw that because for each system, this comes at the front. Musculoskeletal system, GI system, you remember that? Okay. Now, that's the neural tube. Now I'm doing the mesoderm. And this is the somatic mesoderm, splanchnic mesoderm. You remember that? Yes or no? Yes. Yes. This is the notochord. And this is the endoderm. Very good. Now the heart comes around this area, around this splanchnic area in the mesoderm, but the splanchnic area. Why? Why do you think it has to be splanchnic? Yes? Very good answer. Very good answer is because it cannot be somatic, because if you touch the heart, you don't get sensation. It doesn't have a sensory fiber that way, supplied by the autonomic, like GI. Okay? So anything is that, but when we talk about the any muscle, like the musculoskeletal system in the lateral mesoderm, remember that? That is a somatic we are talking about, not this splanchnic. And some part over here is coming. But this is purely this. So now, this picture is around, say, 16, 17 days of the embryonic life after the fertilization. Immediately after that, what happens is that the embryo will be folding a bit. So when the embryo folds, it will look like exactly this way. Embryo is folding, so it becomes a tube now. The whole body is a tube, and this thing is, that this thing is coming over here. This thing is coming over here. This is the somatic, the splanchnic part we are talking, and the somatic remains outside. Now I have to orient you one more time, this diagram. This diagram, the baby is like this way. Here's the head, the leg is other side. I can see the leg very well. Beautiful leg of the baby. It's like this. And there is a coronal section. But this section is in the thorax this time, not in the abdomen. You got it? So this two heart comes to the front over here, two heart over here. So we started with the two heart coming anteriorly in the thorax area. My question to you right now would be, what will be the name of this organ? Quick. What will be the name of this organ? Huh? Lung is not a bad answer. Very good answer. Could be lung or esophagus. Because the GI system comes from the endoderm. Now somebody said intestine. Come on. In the heart I'll get intestine. You don't. But you get the first part, which is the esophagus. Makes sense or not? So therefore this kind of drawing is important for you. And I'll tell you why the embryology makes you understand. And there are many things, will wake you up a bit. Remember the fact, what I'm trying to say over here is how does the heart look like? How does the heart look like? Okay? So heart looks like with the two tubes now. Okay? This is around 20th day. Heart looks like two tubes over there. Now very soon, this baby now, if I do like this, it wakes up. So now it's standing. Not this way, standing. So these two tubes will look like this way, joined together to form one tube. tubes becomes one tube. Do you understand? This picture is the same. The sagittal section only. Is that okay?
Yes.
Now, this is, what I'm saying is that in a perpendicular way, the two tubes join together and it starts beating. In 21 days, this tube, so heart is a tube, it starts beating. Now you may say that, Dr. Paul, you say that the starts beating makes sense to you, but why there should be a nervous system will be functional? Nervous system is not functional at that time, only cardiovascular system. What happens is, under the genetic condition, under the genetic stimulus, expression, one or two cells will be stimulated, and because it is a syncytium, so all the cells will be activated without any nervous system. Make sense? So it is a genetic influence that makes the heart to contract. Okay? When we are doing like this, around 21 days, then the venous system is forming. Okay? Venous system is forming. And the main venous system we call sinus venosus. Sinus means space, venosus is the venous blood which is going towards the heart. So let me draw the sinus venosus. Now look at this. I draw yesterday a bit to you. I'm drawing now the same diagram over here. Sinus venosus. You understand this diagram? You understand the three pairs of veins are coming over there. One pair obviously is your umbilical vein, which is the oxygenated blood coming from the placenta from the mother. The two other was the common cardinal vein and the vitelline vein. These vitelline veins are from the intestine. At that time there was no liver. So vitelline vein and the umbilical vein was draining into the sinus venosus. The concept of sinus venosus is absolutely important for the student. Without that, you cannot understand how the heart looks like. For example, the sinus venosus over here, this is the common cardinal vein. You remember that. This is the right part, this is the left part. It's like this. This one is also called the right horn, and this is called the left horn. And you know that this will all degenerate, and what will remain is this part. This part goes inside, so the superior vena cava can go directly over there, and this forms the coronary sinus. It's clear? Yesterday I indicated to that. Again, I'm talking about this. So, this is the sinus venosus, and major part of that will go inside the heart tube, and this is the heart tube over there. Now, if it is a sinus venosus, I'm not talking, this is an atrium, I'm talking about this is sinus venosus. If I say this is the sinus venosus in the heart tube, which is a muscle, striated muscle by now, and then where do you think the atrium will be there? In the lower part or the upper part? Yes, the lower part. Atrium meaning where the blood is going. That is the atrium. Atrium is space. But where the blood is going, scientifically we call those are atrium. Like left atrium receives blood from the pulmonary vein, right atrium receives blood from the superior inferior vena cava coronary sinus. These are receiving blood, so therefore they are atrium. Ventricle means they are expelling the blood, so ventricle is up. So let me draw that. So what I'm saying is, in this picture, this is your atrium. In this part is the atrium. So this is sinus venosus, then atrium, then is the ventricle up because it is pumping blood over there. I leave a little space over there. This is also ventricle, but it's a special name over there, this one. This is called bulbus cordis. Bulbus cordis. And the last part is called truncus arteriosus. I will explain to that. It's not a big thing. Truncus arteriosus. So what I have done over here, now I complete the heart tube. The heart tube has basically 4 parts. One is the atrium, or called the atrium proper. This is the atrium. This is the ventricle, bulbus cordis, truncus arteriosus, the 4 part. The truncus arteriosus has this, it will be truncus arteriosus means there will be 2 arteries, pulmonary artery and the aorta. That's what it is. Pulmonary, one of them will be pulmonary artery and the aorta. Below that, you have the bulbus cordis. Below that is the ventricle. Both of them will form the ventricle. Both of them will be forming the ventricle. And then is the atrium. And then. Now, the atria comes from the 2 sources. One, atria proper from the heart tube, another from the sinus venosus. This sinus venosus goes inside the right atrium. And therefore, those who have studied already realize the fact that the right atrium has 2 parts, smooth part and the rough part. How many students know this concept? Only 6 students. That's not fair enough. You have to open the book now, today, okay, and see and start reading that it has 2 parts. If you don't believe me, then I'll show you this picture over here. When I put it over there, this is the right atrium. Trust me, this is the right atrium. It is the right auricle over there, right atrium. In the right atrium, you can see there are 2 parts over here. One is the smooth at the below. Can you see it? Another is the rough. All of you should say yes. Yes. You must appreciate that, okay? One is the smooth part, one is the rough part. Together is the right atrium. This smooth part is coming from where? From sinus venosus. This goes inside that. Okay? And there is a line over there called crista terminalis. Crista terminalis actually separates it from the rough and the smooth part. You know that already. Yes, exactly. But you never question about that, why it is a smooth. The smooth part is coming from the sinus venosus. And the rough part is the atria proper. Is that okay? Then, what happens is, so I made a nice model. It took me almost 2 months to make this model. Very difficult. Okay? This is the model over here. This is the heart tube, exactly like this. And the top, I made it like this. Okay? So it is a 2 part, and the sinus venosus, my hand is over here. So the sinus venosus over, blood is coming from there and is ejected on the top. It makes sense? Now, so when it is forming at 21 days, now it becomes 22 days, it is elongated now, and you should expect the heart then in the abdomen, because it is like this way. It is like this way, isn't it? So it is going down. But it cannot go down because there is a diaphragm is also forming, so it has to fold. It has to fold. And the real heart then looks like this. You can take this and show your mom. The mom, you want to see heart? This is the heart. Not this one, but this is the real heart. But it comes from here when it is folding. Now the beauty of that, when it is folding it, then the atrium, which was at the bottom, look at where it is going. It is going posteriorly now. What is anteriorly, they are all ventricle. Is that okay? Anteriorly only the ventricle, posteriorly is the atrium. If you still don't believe me, look at this one. So, well, Dr. Paul, whatever you say, we don't believe you. That's okay. But you have to believe the model. If you see this one, this is the atrium, left atrium, which forms the base going posteriorly, and the ventricle, all I'm touching over here is the ventricle. So the heart is going like this way and coming back. In other words, if I hold the atrium and pull it down, then it will be like this. So the atrium back, is that clear? So when I pull it down, it will be like this. So the atrium goes posterior. At least you know how the heart looks like. Remember, at the outset, I start by saying, how does the heart look like? Heart looks like this or this. This is more adult form. And then they fuse together. But when it is about to be fused, there is a space it creates. The sinus is created. What is the sinus? Transverse sinus. Not coronary sinus. Coronary sinus over here. This is the transverse sinus. Now, Dr. Akif will ask this question. usually his favorite question, in the transverse sinus, okay, if you put a forceps over there, what are the structures anteriorly placed? Now, you don't have to memorize that, you have to do like this. Now, it's very easy, that it will be the pulmonary artery or the aorta. Make sense? And the posteriorly, what will the atria will be there, or the superior vena cava, which is draining into the right atrium. So it should be absolutely clear to you, rather than just memorizing this and that and you fumble, like coronary sinus, this and that, no, this is the transverse sinus. Make sense?
Yes.
Okay. So once you do that, then the next question is how the ventricle is now forming over there. There is a word I have used over here, and this word is called bulbus cordis. Bulbus cordis. The name, the Latin word name itself is the bulbus, means something swelling. You have seen the bulb?
Yes.
It is not like this way, it is protruded out. Right? So if you in the morning you want to see my cheek, I have to see the cheek of Dr. Paul. Now look at me. That's called bulbus. And in fact, your ventricle is like this. It's swollen. If you think about this, it's big swelling over there. Can you see it? The swelling is just over there. Now, not all the ventricle does it. So beautiful thing is over here is you have two parts of the ventricle. One is the ventricle proper coming from the tube. Another one is also proper coming, but it's called bulbus cordis because it swells up. Now, tell me with some intelligence, which part of this will form the right ventricle, which will form the left ventricle, and why you are saying that? I have given you two choices. One is the ventricle, one is the bulbus cordis. Bulbus cordis swells up and forming a ventricle, another ventricle. So you have two ventricles, left and right. Which one will form the right ventricle? Okay?
Bulbus cordis will form the left one. Bulbus cordis will form the left one.
Right ventricle, why?
The left one, because the...
No. Yeah, at the back? No, at the back. You.
Left one should be larger because it needs more muscles to contract to pump the blood around the body.
Yes?
Maybe because when you fold it, the bulbus cordis will be the...
Okay. Partly yes, no type of thing, answer I'm getting, but the answer is like this. You know, and this is not rocket science I'm talking about. Bulbus cordis, when it swells up, okay, the muscle swells up, it will be thin or it will be more tight. It will be thin. If you look at my chin, if I do, it is getting thin, and the more I do, it will burst. So out of the left and the right ventricle, which one is thinner? The right ventricle is thinner. So major part of the bulbus cordis forms the right ventricle. Is that clear? The one which is not swelling up, it is coming from the ventricle proper, from the heart tube itself. Make sense? So therefore, when it is swelling up, it is pushing the tube towards the left, and that is forming the left ventricle. So left ventricle and the right ventricle. So remember the fact, the major part of the right ventricle, which is coming anteriorly, sternocostal surface, is coming from the bulbus cordis. Make no mistake about that. The other part also coming here and there, I'm not going to talk today, only in the class. So this is absolutely clear to you? So let's recapitulate one more time. You have the sinus venosus at the bottom, and this sinus venosus is associated with the three kinds of veins on either side, left and right, and they are the common cardinal vein on the right, the left common cardinal vein on the left, and then you have the other two vitelline vein and the umbilical vein. And I showed you yesterday that this lower part, particularly this one, will be separated out because of the formation of liver. Very good. So the liver is over here. Slowly the liver is forming, and those two veins on either side, so total four, it's over here, and the vitelline vein, which was over here and over here, forming the portal vein. Make sense? Obviously, I told you, please remember that the right umbilical vein will disappear, mostly. The left survives. right? The left survives till the birth of the baby. And then after that, ligamentum teres, and then it bypasses the liver, ductus venosus joining over there. So that story I told you yesterday a bit. So that's not important today. But this is the final story over here, that when the liver is forming, the two veins on either side are detached from the sinus venosus and remain over there. So this is okay. Okay? And the folding actually makes the atrium posteriorly. So if it is a heart tube, the truncus arteriosus is on the top, and the atria is over here. Atria means receiving the blood, which is near the sinus venosus, that goes posteriorly. Make sure that you understand. So you have two ventricles over here, and the two ventricles coming from the two sources. One the heart tube proper, the ventricle proper. Another one is also proper, but it is a special name called bulbus cordis, the Latin word actually meaning the swelling. Again, the genetic expression, and is forming the major part of the right ventricle. Is that clear? Okay. And the detailing of that I will talk about in my class. So this is absolutely clear. Now, I told you in the class that sometimes this part does not disappear. That can form another structure called the left superior vena cava, and usually we talk about that you know where it will be draining, how it will go to the heart through this coronary sinus. Make sure that you understand this. This forms the coronary sinus. The left horn of the sinus venosus forms the coronary sinus. That remains over there. Everything is disappearing, but that remains to form. But if you see a vein which is attached over there, it has to be left superior vena cava. Is that okay? Now, why are we doing this kind of thing? My first diagram over here is very important. When I say that what is this structure over there, you say that esophagus, right? So the esophagus is over there, it's coming from the endoderm, so it's okay. Now why these diagrams are necessary? It is necessary because sometimes you see the blood is not coming properly from the left atrium to the left ventricle. Normally, in the diastole, everybody knows the ventricle receives the blood from the atrium. And the blood will be coming from the left atrium to the left ventricle. That's a normal thing. And then it closes and forming the first heart sound, right? But if it is not closing, opening properly, like there is a little stricture we call mitral stenosis. So the amount of the blood which is staying inside the left atrium per unit of time will be much more. And it will swell up. And look at that, you know, if it swells up, maybe I'm just in a rough way I'm showing that it is swelling up. This is the left atrium which is swelling up. What will happen? It will pressurize esophagus because they are very close. This structure, heart and this is very close at posteriorly. And you may get a dysphagia. So a patient comes to your clinic and complaining that, doctor, I cannot eat properly, or I eat properly, but then I feel that something is bugging me over the last 3 months. And you said, oh, look, I'm a cardiologist. I don't deal with the eating problem. Go to a gastroenterologist. No, that's not the right thing. You have a stethoscope, just put the stethoscope on the mitral valve to understand there is a murmur in the diastolic murmur is there, and they find out, and it can mimic. So you understand why the left atrium could be increased inside, very common in the mitral stenosis. Is the one and only mechanism you can see. Okay? So this is the way you think about. That's what I was about to tell you, that how does the heart look like? The heart looks like from the two different parts, from the splanchnic mesoderm, from this side, then when the embryo is folding, it comes anteriorly on the splanchnic. Why splanchnic? Because it has to be supplied by the autonomic nervous system. Then the endoderm over here at the back is always, this picture is there for any system I draw, isn't it? So this time is over here. Then I said that this, if you put it this vertical way, it becomes, this one and this one is the same heart tube. But it's divided into 4 parts: atrium, ventricle, bulbus cordis, truncus arteriosus. At the bottom of that, you have this, you know, the sinus venosus is there, or the 3 groups of veins are coming. Then when the liver is there, 2 groups is separated out. Only the cardinal vein is there. One side cardinal vein is gone, and leaving only the coronary sinus. So all this story I'm telling you is how does the heart look like to start with. Finally, the final drawing, and I think you can do much better than a drawing like this. Don't do any more like this. For physiology point of fact is okay. But now you're a medical student, even physiologists say the right atrium is coming. This is supposed to be a right atrium. But pay some attention that this does not look that. And I'm drawing that, okay? So how you do it, you put a little bit like this over here, and you have seen a cat, the cat's eye. Draw like that. Okay, this is your heart. And try to do by yourself. You can do much better than me. Now in this diagram, this one is my pulmonary artery, so I'm trying to do in a blue color over here. So this is the blue color, and of course it will be divided into two parts. Make sense, this diagram?
Yes.
This is the aorta, it's going like this way, so I put the aorta over here, and this aorta obviously is coming like this, and it has the branches, and it's going posterior. It will go posteriorly, so it is going over here. Oh, I can see a beautiful aorta coming this side. Trust me, it is over here. Because I cannot draw, it's a 2-dimension, it's a 3-dimension, then I have to do it. Okay? Now why I'm drawing this way? Because of the fact that I know for sure that it is going from the right ventricle, and this is going directly from the left ventricle. And the right atrium, although initially it was a little bit posterior structure, then slowly it comes a little bit anteriorly, laterally, not anteriorly, laterally. So I'll draw the right atrium also with the, and over there is the superior vena cava is draining, inferior vena cava is draining. That's a nice picture. Now I want you to do again and again. The reason is, not next week, the following week, you'll be given a chest X-ray to identify the border. Remember, I started by saying that how does the heart look like? That is the theme of my presentation over here. Okay, the lab. So now how does it look like in the X-ray? You'll start with the aorta. We call aortic knuckle or aortic arch, actually. It is going posteriorly. So the left border of the heart is formed by the aorta, then pulmonary artery, then the auricle, left auricle, and then the left border of the heart. Do it with me one more time. What is this one? Aorta, then pulmonary artery, then left auricle, then left border. So you don't have to memorize. I hate memorizing this thing when the concept is clear. You can have a better concept than me. You are young, I'm not. I forget, But in the drawing is much better. Osama, I tell the student when I go for chicken burger, I draw chicken. I said, I need a chicken. You understand the chicken burger? Chicken. They know already that I draw a chicken before the drawing has 1,000 words that you can express. You don't have to talk about that. Look at the left border then. Left border starts with the superior vena cava of the heart. Then the right atrium, not the ventricle, because atrium goes a little bit laterally, right atrium, not anteriorly. Remember the fact anteriorly is always the ventricle, and the major part is the right ventricle. And then the right atrium over here, okay, right atrium, not ventricle, atrium, and the inferior vena cava. This forms the right border of the heart. Is that okay?
Yes.
Very good. Finally, make no mistake about that when we ask about the right atrium, which is very important, and I think in the lab you will be having, they will be having today, or? Okay. So you will see that there is a rough part and the smooth part, and those things you do it, especially for the right atrium. I will emphasize more on that. There is a smooth part is also there in the ventricle and the right and left. We'll talk about that, not too much this time. But the major part, the smooth part of the right atrium is more emphasized today because it's coming from the sinus venosus. Is that clear? And the other aspect I want to tell you over there that make sure you understand that the borders, how it is reflected in the X-ray. Okay? Any question that is bothering you? It's clear now, absolutely clear that how the heart looks like. Thank you very much. Yes.
Doctor, for the truncus arteriosus, what does